Good evening, everyone. I'm Sayukta from Beautiful Spotless Skin team. I'm sure all of you must be keeping good health. You must have come across people, especially women, with brown color patches on their face. They seem like freckle-like spots forming large flat patches. This is nothing but melasma. Melasma is a common chronic skin condition in India. According to a study conducted across 4 Indian cities, reveals that more than 80% of the population present skin color heterogeneity on the face, irrespective of age and gender. This heterogeneity mainly results from hyperpigmented spots and uneven skin tone and melasma. Indian skin tone is more prone to pigmentary disorders. It occurs mainly in women, 90% and 10% of males of all ethnic and racial groups. Around 20 to 30% of 40 to 65 years old women present a facial melasma. Uneven skin tone, melasma, and hyperpigmentation generally ignored as sign of aging and often misunderstood skin condition. Melasma sufferers have been misinformed about aspects of this common hyperpigmentation issue. This can lead to frustrating setback in treatment. To avoid all these hassles and to keep you informed, today we are here to know about uneven skin tone and hyperpigmentation. So let's connect today with our skin expert, Dr. Shilpa Bhat, live from Bangalore, to make aware of management of uneven skin tone and facial pigmentation. Dr. Shilpa Bhat is a young and dynamic dermatologist who holds a master's degree in dermatology and a fellowship in cosmetic dermatology. She has been an outstanding medical student and recipient of the gold medal for Best Outgoing Student of GAMES for the academic year 2007 for excelling in academics, sports, and extracurricular activities. She obtained her MD from the prestigious Bangalore Medical College and Research Institute, during which she was trained in the diagnosis and management of various dermatological disorders, as well as performance of various diagnostic and therapeutic dermatological procedures. She has been practicing cosmetic dermatology for the last 14 years. Her areas of special interest are acne and its scars, pigmentary disorders, and treatment of aging face. A very warm welcome to you, Dr. Shilpa Bhat. Hope you're doing good, ma'am.
I'm good. Thanks for the kind introduction, Sanyukta. That was quite elaborate. We can start today's session.
Yes, it's a pleasure to have you with us. And as today we are going to talk about uneven skin tone and facial pigmentation, we would start our session with the understanding of melasma, doctor. First of all, we would like to understand what is melasma.
Melasma is basically one of the disorder of hyperpigmentation, wherein you will see these patches, brownish to dark brown patches on the skin. So generally it will be located in the center of the nose and the cheek areas. Sometimes you also see them on the brow areas and also on the chin and jawline areas. So most commonly, though, it is like a butterfly area, wherein the center of the face, the nose and the cheeks are involved. And it is also called as pregnancy mask. Basically, the hormonal changes during pregnancy, it can start. And also the other factors like ultraviolet light exposure and the sunlight exposure. A lot of other factors like hormonal pills and other medications also like anti-epileptics, painkillers, they can also aggravate melasma. So medications, ultraviolet light and chemicals like hair colors and even the cosmetics sometimes. These are the reasons for in general pigmentation, but melasma mainly is hormonal and UV light. These are the two main factors involved.
Right. Another big issue with especially Indian skin is uneven skin tone. Now we would like to understand, is uneven skin tone and melasma the same thing or they are different?
No, they are totally different. As I said, melasma is basically hormonal, but this uneven skin tone is mostly genetic. So we Indians, we have mainly, type 4, type 5 skin, wherein the skin melanin tends to be more. So the melanin production as such is high in our skin, and due to various other factors like sunlight and a lot of other things, I'll come to one by one. So, but then, uneven skin tone is wherein you will see more different shades of color skin tones in different parts of the face. So the cheeks may be relatively brighter. Around the mouth, there may be pigmentation. Around the eyes, there may be pigmentation. And the forehead, temple area, some people will have pigmentation. So this, the variation in the skin color is known as uneven skin tone. It becomes a very difficult task, especially for the makeup artists and for people who want to put on makeup, because one shade cannot cover all the areas. So they end up using color correctors and multiple layers and coats of makeup. And it is a daily struggle for women who put makeup. So that is the uneven skin tone. And melasma and uneven skin tone are totally different.
Yes, and by what you know just said about uneven skin tone, I can make out that it's so common, especially in India. I mean, so many people, especially women, have this issue of uneven skin tone. So we would like to tackle this issue and understand how we can fix it. Again, because there is this melasma and there is hyperpigmentation. So are they the same or they are again different?
See, melasma is one of the reasons for hyperpigmentation. Under hyperpigmentation, it just the term, if you can understand, hyperpigmentation. So hyper is extra or excess, and pigmentation is basically the color, pigment in the skin. So hyperpigmentation can be due to many reasons. So for example, if I start from the forehead, I'll list out the reasons. So forehead, we see many a time something called acanthosis nigricans or the maturation pigmentation. People who are fat and dark and those who have got insulin resistance, we see a pigmentation on the forehead. And sun tanning can happen in the forehead. And due to amritanjan and painkiller application, all this can lead to, again, pigmentation on the forehead. Pigmentation on the forehead can also be due to hair dye allergy. We call it pigmented contact dermatitis. So a lot of things in the forehead like this, okay? And then coming down, if you see on the cheeks, yes, melasma is the commonest reason, but then it can be due to other reasons also. There can be something called nevus of Horai or nevus of Ota, wherein it's like a birthmark, and there can be freckles also. Those freckles are small, tiny spots which you see. They may be few, they may be plenty, depending on, again, genetics and sun exposure habits. And then if you see the corner of the nose, some people will have these dark areas over here. We call it seborrheic melanosis.
Yes, doctor, are you there with us? Before the doctor gets back to us and joins us, today we are talking about melasma, hyperpigmentation, and uneven skin tone, and we are trying to understand how are they different. How is an uneven skin tone different from melasma, and how is melasma different from hyperpigmentation? Doctor, are you back with us? Okay. Yes, doctor.
Yes, I'm back. Sorry, I got listing out the causes of hyperpigmentation. So
Yes.
melasma or the freckles are the reasons. And below the eye, we see this periorbital melanosis. The reasons can be plenty. It can be due to anemia or less iron in the body. It can be due to excessive eye strain. It can also be due to some allergies where the patient is rubbing the eyes repeatedly, and because of that, there is a hyperpigmentation. Spectacle, which is tight, which is sitting over here, that can cause a pigmentation over here. And then eye kajal allergy and things like that also do come sometimes below the eye area. And it is just because the tear trough, where the shadow effect is there, the eye, below the eye, there is a skin which has gone underneath, depression.
Right.
Because of that also, we do see hyperpigmentation like thing. So again, people say it is a dark circle, but it's not actually a dark circle. So that kind of issues can be there. Then again, if you come down over here, again, jawline area, this area, there can be pigmentation due to cosmetics. So some cosmetics do cause a reaction called Reels melanosis or lichen planus pigmentosis. That can happen over this jawline area, and even that can extend up to the neck. So a lot of reasons, as I listed, from forehead to the chin, for reasons for hyperpigmentation in the face. So
Okay.
hyperpigmentation and melasma are totally different entities. But yes, one of the condition is melasma for hyperpigmentation.
Okay. And doctor, how do you diagnose hyperpigmentation?
So as I told, we first take the history. So depending on the condition where it is located and with the history of the patient, we'll be able to diagnose what is the reason for the pigmentation. So many a times we'll be able to figure it out, like, if it can be cosmetic, ultraviolet light exposure, it can be hormonal imbalance. All these things we just go on ruling out by the history itself. And certain pigmentations are very classical, like melasma. The moment we see, we are able to say it is melasma. So it is mainly history and clinical examination. We don't require any special test to diagnose melasma or hyperpigmentation. By the look of it, you diagnose this, and then we go according to the reason of it. What is causing the pigmentation?
Right. And what are the treatment options for melasma or and hyperpigmentation?
Yes, coming to melasma, again, if the patient is on hormonal pills or any reason, if we are able to figure out, then we try to eliminate that, then limit the sun exposure. So we educate the patient first regarding how to apply the sunscreen, how frequently they should use it, how much quantity they should use it, all these things. So when you use a sunscreen, all these things matter a lot. So once the sunscreen application in the morning and the night, we tend to give depigmenting creams, which can either be targeted at reducing or stopping the melanin production, and also to remove the existing melanin. So there are creams like glycolic acid, lactic acid, salicylic acid, which just remove the dead skin, and so the existing melanin is taken away. And also the new melanin production is inhibited by drugs like hydroquinone, kojic acid, arbutin, we have got licorice, we've got curcumin, so many products. So there are many, many molecules which can help in reducing the hyperpigmentation.
Right. And how good it is to visit a dermatologist as soon as we start, seeing spots or pigmentation in our skin.
Yes, it's very important to get yourself evaluated, because all pigmentation is not the same. Just now we listed out so many reasons. So what is the reason for your hyperpigmentation, that you got to know. In case, like, if it is melasma, early diagnosis is always better, because when we start the treatment early, we will be able to limit the spread of the disease, as well as we'll be able to reverse it to a large extent. But yes, melasma, because it is genetic, we may not be able to cure it completely, but we'll be able to help the patient with respect to the pigmentation, and cosmetically we'll be able to help them out. And also limiting the spread will be easy when they come to us in an early stage. Even if it is an advanced case, we'll be able to help them out, improve their quality of life. So there, the role of dermatologist comes. If you ask your neighbor, if you ask your chemist, and you buy some creams and apply on your own, many of these medical formulations which are available in the pharmacy will be having steroids in it or hydroquinone in them. Many of them will be just giving to the patients without prescription. So it is very risky creams, and these steroid creams applied on your face for a long time have got innumerable side effects. So including excessive hair growth, and your skin becomes red and very sensitive. It can become sensitive to sunlight. It can get thinned out. We call it a skin atrophy. So we do see a lot of patients who come to us after topical steroid abuse, which is given by their friends or neighbors or by medical store people. Somehow these medications are being sold without any restrictions, and that has become a difficult part of treatment. Treating melasma is easier than treating the topical steroid abuse. So it is always better you consult a doctor and then your medication prescribed.
So it's a big no-no for self-medication or over-the-counter medication. So please restrict yourself from going to a chemist or pharmacist and asking for an over-the-counter, cream, etc. And go to a qualified dermatologist, before you end up worsening your condition. So it's really important to go and consult a doctor, a dermatologist, a qualified dermatologist in this case. And how can we prevent uneven skin tone and hyperpigmentation, doctor?
So uneven skin tone, basically first thing we need to know is a good skincare is essential for this. So knowing your skin type, whether your skin is dry, oily, combination, what kind of products you should use. This is a very basic thing in management of uneven skin tone. Because if your basic skincare is not correct, if your skin is too dry, you're likely to have an uneven skin tone. If your skin is excessively oily, that also can lead to uneven skin tone. And then coming to the daily skincare, how you should apply your creams, serums, your sunscreens, all that you need to get it properly advised and follow it, properly. So what happens, sometimes we miss our creams, we tend to ignore our sunscreen, we tend to apply a lot of cosmetics. That itself can lead to problems. The other thing is lifestyle. Again, the food habits and our weight. Are we, proper with the BMI? We need to check that. And the hormonal imbalances that women go through. So the cycles and the issues related to menstrual cycles, that also can lead to uneven skin tone. So any hormonal imbalance like PCO, thyroid problems, or any other B12 deficiency, all this needs to be checked out. So in this case, first we need to reason out if there is no reason, if it is idiopathic or genetic, if it has come in the families, then also some certain creams can help, like the creams that contains very mild depigmenting agents like kojic acid, vitamin C, arbutin, licorice, curcumin, beta white. All these are very subtle and slowly depigmenting agents which have no much harm in the long-term use. These kind of medications can be used for maintenance of uneven skin tone. And also regular exfoliation, a good face wash which contains a gentle glycolic acid or a lactic acid, which can help in removing the dead skin. And also always nourishing your skin post washing your face. Just nourish the skin with either a nourishing serum or a good moisturizer, and then protecting it from sunlight with a good sunscreen which is suitable for your skin color. I do get patients telling me that after I apply the sunscreen, my skin becomes dark. So if the sunscreen is not suitable for you, you are using a sunscreen which you are not, your skin is not adjusting well, then get it changed. There are physical sunblock and there are chemical sun filters. Some people may not accept the chemical filters that easily. So maybe physical sunblock might help you. There are tinted sunscreens which can help in covering the uneven skin tone as well. So depending on your skin's requirement, you might have to experiment a little bit initially with your doctor. You might need to revisit and get your products prescribed as per the needs. So that is important. And strictly following your skincare routine is equally important. So those with uneven skin tone, especially, they need to be very particular with their skin products and not experimenting with the makeup products and also with the face washes and cleansers which are available just because they have some sale, discount and all that, or online it is lot of products they come across. Something that works for your friend may not be the right product for you. So before buying, you need to first check your skin type and know and understand your skin, and then only you can use the products. And better to stick on to certain brands which that it is fine with your skin.
Right. We all are different as an individual, so is our skin, so is the requirement of our skins, etc. So please don't just follow a product or buy a product just because your friend or your family members are, using it and they are finding it appropriate for their skin. Please go and consult your doctor. That's why we are, emphasizing the your dermat visits, so that you can understand what's your skin type, what's your other issues with your skin. If there is anything, the doctor will try and try to fix those issues, and they can actually help you in going for the right kind of wash, moisturizer, serum, sunscreen, because sunscreen again is very important. Now we are continuously talking on this point that sunscreen is very important for your skin. It's a daily thing, and you need to apply sunscreen regularly at the right quantity, at the right number of times in a day. Please shed some more light over that, doctor.
So let's come to very specific about sunscreen. Sunscreen, I just told you there are two main categories, broad categories, physical and chemical blocks. Right. So those patients who sweat a lot, who are swimmers, we prefer chemical blocks. Physical blocks are preferred for sensitive skin and also for sports people. Coming to the how to apply and when to apply. So sunscreen, we in India, we say 8:30, 11:30 and 2:30 main times to apply. Basically 20 minutes before sun exposure, you are supposed to apply your sunscreen, and adequate quantity of sunscreen should be applied. That is about 3 ml of sunscreen is required for the full face. So one palm area, the entire face, you will have to use one entire finger. This much sunscreen is required. That is about half a tablespoon. So it's quite a good quantity of sunscreen that you got to apply, and then reapply. Every 3 hours at least you got to reapply. If you are indoors, we say apply in the morning and again during lunchtime. So at least 2 times you can apply. Even if it's a cloudy day, please use your sunscreen, because UV light passes through the clouds, and it is important to use it even on a cloudy day. And if you are sitting in front of blue light, it is very important to use your sunscreen. If you are in front of the laptop or any electronic gadgets, it's good to use a sunscreen. Again, infrared light and even the visible light can increase melasma. So even if you are at home, use a sunscreen. Those patients who have melasma, I ask them to use their sunscreen when they are entering the kitchen in the morning. Housewives who want to cook in the morning, they have to use sunscreen and then only go to the gas stove, because infrared light, IR light itself is known to induce melanin production. So the sunscreen application quantity, frequency, and also the regularity is very important. And night, yes, of course, you don't need to apply a sunscreen. Night, we give a depigmenting medication. So sunscreen for the body is also important. Those who are exposing their body to sunlight, those who tan easily, they have a problem with tanning, then they can use it. But again, here there is something called vitamin D deficiency concern, which many patients come up with. If we use sunscreen, we may not get enough vitamin D, which to some extent is true, but it is not always true, because majority of us don't apply the sunscreen as per the recommended quantity. So vitamin D production goes on. But still, if you are exposing your body, if you are on a beach side, I do recommend the patients to, expose the body to sunlight in the early mornings, like, 8 to 9, or in the late evenings, like 4 to 5. During that time, there is less chances of sunburn. So, and you do get vitamin D from that sunlight. So it is one way of preventing sunburn and still getting a vitamin D. But still, those with a concern of pigmentation and tanning, it's better to use a sunscreen. And if you are deficient, please take your supplement dosage.
Right. So there's no escape from a sunscreen if you're going out, if you're, going to stay inside, or, what climate it is. You need to apply sunscreen regularly with the right amount of it and the right way of application, and reapplication again is very important. So no escape from sunscreen. And that's why, again, it's important to choose the right kind of sunscreen. As you said, doctor, that many people do complain that, I get very sweaty, or I start having acne after, using sunscreen, or I get a very patchy kind of an appearance, or I get darker. So for all that, again, we need to first analyze or evaluate what is our skin type, and then go for the right kind of sunscreen.
Absolutely. So for oily skin types, we generally prefer gel type of sunscreens. And again, these gel type of sunscreens don't have a moisturizer. Don't get confused with that. Again, you have to put moisturizer first and then put the sunscreen. So some patients do tell me that, doctor, I have a oily skin. Why do I need a moisturizer? So we do give a water-based moisturizer. Even sometimes water-based moisturizers are important for the skin tone. In fact, just to make your skin soft and supple, it is very important. Sometimes people feel very dark and uneven tone because their skin just lacks moisture. So it is important to put your moisturizer and then put your sunscreen. So we just deviated from the topic, but I felt it is important to share it with our viewers. Yes, the type of sunscreens and related to the skin types. For those who have got oily skin, I said gel type of sunscreen. Those who have got a dry skin, we give lotion type of sunscreens. Again, these to be applied on moisturizers. Those who have melasma, there are tinted sunscreens which are available, which can act as a foundation cum sunscreen. So tinted sunscreens are also available. And those who want a matte finish, yes, we have a silicone based sunscreens which give a matte finish. So different kind of sunscreens. There are n number of sunscreens. There are sunscreens which protect you from pollution. There are sunscreens which protect you from blue light specifically. So depending on what kind of person you are, what kind of activities you are involved into, your skin is exposed to, depending on that, get your sunscreen prescribed.
Right. And as we were, discussing moisturizer, what water is to our body is what moisturizer is to our skin. So yeah, you need to moisturize your skin. And of course, you need to apply sunscreen regularly. So no escape from any of these. And now, doctor, can we actually fix uneven skin tone with a good skincare routine? Like, for example, if I have an uneven skin tone and I start following you by maintaining a good skincare routine, are there chances that I'll get back to an even skin tone?
Yes, of course. Majority of our patients feel much better when they start a good skincare routine. And once it is reached, we should not ignore it. There are times when the patients use it for some time, say 3 months or 6 months, and then they give up. Right. So that should not happen. There are creams for maintenance as well. So this maintenance is very important when it comes to uneven skin tone, because genetically we are all programmed differently. You just told that every skin needs some kind of nourishment. So we need to maintain it as well. So once we treat, yes, definitely it becomes better. But then you cannot give up just because the skin became better. You should continue that as a routine. So that's why it's called a routine skincare routine.
Exactly. That's why it's a routine. Yeah. So you need to have a good skincare routine throughout. See, we can't just, say that I'll eat once in a week and then, because I have eaten well once in a week, then I don't need to eat. You don't do that, right? So don't do that with your skin as well. Maintain a good skincare routine, which is regular, which is forever. We'll also take some of our viewers' questions, Doctor.
Yes, sure.
Lata Mandi is here asking, ma'am, my face skin tone is darker compared to my body. It's very dull and oily. My age is 38 and I'm also having dark circles.
So this is a common problem that we come across. Has she mentioned her weight and any hormonal imbalance issue? So middle-aged women generally go through some kind of a hormonal turbulence. So in this patient, we would like to check that if she has got any hormonal issue. And of course, her sunlight exposure to UV light, infrared light, how much is in front of the gas stove in the kitchen, all this matters. And putting her on a good skincare routine is very, very important. So if her skin is oily, yes, a gel kind of a moisturizer and a gel kind of a sunscreen, and then a good face wash, which can take off the dead skin, like something that contains a glycolic acid or a lactic acid can help her. Even face washes can have other medications as well. So licorice extract, arbutin, kojic acid, all this can be there in the face washes also. So a combination of different ingredients would help her with respect to the skincare routine. So a good cleanser, a good moisturizer, and a sunscreen in the morning. She needs to redo that during her lunchtime. And also night time, Lata can apply a depigmenting. First, she can start with simple ingredients like vitamin C serum or a niacinamide serum if vitamin C doesn't suit her, or arbutin and kojic acid containing creams that can help, or simple glycolic acid based also. I do alternate sometimes, niacinamide one day and the other day glycolic acid serum or a lotion. So that can help in getting rid of the dead skin. So this is a plan. This treatment can be a plan for 3 to 6 months. So initial treatment, and then there is a maintenance phase. So she can even go for chemical peels and laser skin toning, depending on her lifestyle and also depending on her requirement. So first she needs to get herself evaluated.
Right. So Lata, now you know what you need to do. We have Sumit Singh asking, I would like to understand if I have any medical issue with darker forehead versus entire face. Is it just a tan or some medical help is needed?
Sometimes, again, this can be acanthosis nigricans, forehead pigmentation. You need to first mention the weight. If you are overweight, obese, then that can be a possibility. So that leads to a syndrome called metabolic syndrome, wherein you might have insulin resistance. It can be simple pigmentation due to suntan also. It can be due to hair color. Again, it can be due to application of amritanjan or painkiller balms on the forehead. So what is the reason for your forehead pigmentation? We need to analyze and then treat it.
Okay, so you better go and consult your dermatologist, Sumit, and in case you are located out of Bangalore, then you know where to go, whom to consult. Doctor is here right away to help you out. So Dr. Shilpa is here. We have Mahendra Singh asking, actually my skin tone is getting darker and I'm getting a very uneven tone. What can I do? Please suggest.
Skin tone turning darker, again, first thing, UV light exposure, sunlight exposure, all that blue light exposure. First, we have to see that. And if you are gaining weight, just restrict that. What you're eating, you need to look into. If you're consuming a lot of junk food, again, you need to switch over to a healthy diet. In case if you've got a pre-diabetic status, overweight, obesity, that also needs to be looked into. So more of a lifestyle disorder of late, we are seeing this facial pigmentation as. So this again is a case probably of lifestyle disorder. So you need to again get yourself evaluated. Very difficult to say only with one line question, very, very difficult. Right.
So please go and consult a qualified doctor, Mahendra. And we have Chandrasekhar Mishra asking, would it be better to incorporate vitamin C in my daily or night routine, in my day or night routines?
Yes, it is a good skincare ingredient, vitamin C, because it acts as an antioxidant, it acts as an anti-aging product, it can act as a brightening ingredient, as a depigmenting ingredient. So it's a wonderful ingredient if you incorporate in your skincare routine, and if your skin accepts it well, that's very good. So if you have an acne-prone skin, then you have to just slow down a little bit before including vitamin C serum. You need to check it out first. But vitamin C, yes, of course, it's a good skincare ingredient. You can use it.
So vitamin C as a serum you can use. You can intake, increase the intake of vitamin C. But don't rub lemon on your face, because many a times, doctor, I have seen people coming and saying that, I use a lot of lemon juice on my face. So how bad it can be? Please tell that also.
Lemon, yes, of course, it can cause burns also. Sometimes we have seen all these red faces and then leading to post-inflammatory hyperpigmentation. One of the causes we missed out, Sanyukta, is a post-inflammatory hyperpigmentation, which happens due to application of these ingredients which can irritate the skin. So lemon, garlic, and whatnot. People do try everything available in the kitchen. So it becomes very mess in the face many a times. So once you get us, burn because of that. So it's better to avoid. Vitamin C, which is available in the market or in the pharmaceutical preparations, are very purified forms, and they are stabilized with a gel kind of or a serum formulation, so they are quite safe. But directly from the lemon, because it has got other acids also, it's not just vitamin C in the lemon, there are many other ingredients which can irritate your skin. So vitamin C directly from the lemon or santra is not a good idea. And even orange peel, don't apply directly on the skin. You need to know before putting that, because there are many other impurities which are there along with the vitamin C. And vitamin C concentration is very important. Anything which is less than 10% may not work. Anything above 20% may not be great also. So 20% we say is ideal for using. But again, 10% vitamin C given in a proper formulation works. So skin is a very good barrier. It doesn't allow any ingredient to enter into your skin. It needs proper formulations and proper vehicles for the skin barrier to penetrate inside. So when vitamin C has to work, it has to enter your dead skin layer and then reach the lower layer of the skin. For that, it needs to be given in a proper vehicle. So I do see patients who say, doctor, I prepare vitamin C at home. How good is that? Or doctor, I am preparing vitamin C from the tablets which are available. So again, these are
right. So the bottom line is that we don't need to abuse our skin. We just need to, apply, okay, vitamin C serum you can apply. You can eat a lot of vitamin C through various, things that's available, but don't abuse your skin, and eat well. And in case you have any problem then with your skin, then despite of running to the kitchen, please run and go and see a doctor. That's most important. And Dr. Shilpa, before we bind up, any take home advice for our viewers?
Take home advice for the viewers, because facial pigmentation is quite disturbing to the patient. Any kind of melasma or any patches on we see on the face, we get disturbed, and in that panic we end up using any of the products which our trusted people will suggest. So please don't do that. Use your common sense. Use a qualified doctor. Meet a qualified doctor and get it prescribed. Get yourself evaluated. And the other thing is, yes, first thing is basic sunlight protection. So be very regular with your sunscreen and be very regular with your skincare routine. And don't fall into this online pharma lobbies, because somebody is going to sell some product. They are going to tell you that that product, please use, your face will become bright. That is not true. So be sensible and get yourself examined and treated if you have a pigmentation issue. Many of the pigmentation issue are treatable. So those issues which are treatable, why don't you get it treated from proper way and more scientifically than getting somebody's advice and getting your skin more into more problems.
Exactly. So in case you have a problem, please go and seek the right advice from a right qualified dermatologist. Thank you so very much, Dr. Shilpa Bhat, for your valuable time. It has been a very informative session, and it was, again, a very great and pleasuring experience to hear you. We really look forward for many more such sessions in the coming times. Thank you so very much.
Thank you, Sanyukta. You were a nice host. Thank you so much.
Thank you. And viewers, thank you for your active participation in today's session, and stay connected to our Beautiful Spotless Skin page. Bye-bye. Good day to all of you.